Now we have the honor of hearing from 4 women who will provide their own firsthand perspectives on our immigration system and the challenges immigrants face to receive due process and cope with the trauma and uncertainty they endure. Veronica Aguilar is an undocumented immigrant from El Salvador. She will speak with the help of an interpreter, Nicholas Zaccaro, about her experience being detained in an Orange County jail from November 2017 to June 2018 on immigration charges. Since her release, Veronica has become a vocal advocate for those still detained. Angela Chan is a policy director and senior staff attorney managing the Criminal Justice Reform Program Advancing Justice at the Asian Law Caucus in San Francisco. Angela represents immigrant families whose children are caught up in the juvenile justice system. She also works on policy reforms to disentangle local police from immigration enforcement, including co-leading the passage of the Trust Act in 2014, the Truth Act in 2016, and the California Values Act in 2017, which are state sanctuary laws here in California. Layla Razavi is the policy director at the California Immigrant Policy Center. Layla plays an integral role in shaping the policy agenda and priorities for the organization, including providing policy analysis and counsel on critical issues impacting the safety and civil rights of immigrants. Her work carries a specialized focus on expanding due process protections for immigrants and communities of color at the state and national levels, including providing legal protection to immigrants at risk of detention or deportation. Leah Spellman is the executive director at Partnership for Trauma Recovery, an organization that addresses the psychosocial impact of trauma among international survivors of human rights abuses. Please, let's give them a warm welcome. Each panelist will talk about their work on immigration issues, and then we will have time for a few questions from NUHW members. So let's get started by hearing from Veronica.
Good afternoon to everybody. I'm Veronica Aguilar Sosa, and I'm from El Salvador.
Yo salí de mi país el año pasado en octubre.
I left my country in October of last year.
Por problemas de violencia de pandillas.
And I did this because of gang violence.
Ya que en Centroamérica hay mucho problema con pandillas, división de familia a causa de ellas, separaciones.
Gangs in Central America are ripping families apart, and they're ravishing our country with violence.
Las pandillas obligan a muchas personas a ser parte de ellas o a hacer cosas que ellos quieren para sus pandillas.
They force a lot of people to join their gangs or to do their bidding.
A causa de eso, uno tiene que salir huyendo porque uno no quiere hacer cosas que no debe.
Now, we don't often want to do things that you shouldn't do, and therefore we have to flee our country.
Después de algunas amenazas de muerte que hicieron y me amenazaron con armas, decidí salir fuera del país.
Now, I was under death threat, and after these armed threats, I left my country.
Con poco dinero y sin saber realmente qué hacer o para dónde ir.
Didn't have much money, and I didn't know where I was going to go.
Decidí llegar a México, que era un lugar que yo ya conocía.
I decided to go to Mexico. It was a place that I'd already gotten to know.
Llegué a Tapachula un día domingo por la mañana.
So I got to Tapachula. It was a Sunday. It was in the morning.
Aún estaba allí, no tenía dinero y no sabía qué hacer cuando alguien me habló de una caravana que salía de Tapachula hasta Tijuana.
Now, I was there. I didn't have any plans. I didn't know what I was going to do when someone talked about a caravan that was going to go from that town of Tapachula to Tijuana.
Decidí unirme a ellos porque en ese momento no tenía nada más y no sabía, pero dije, yo me voy con ellos.
You know, and I decided to join them because I didn't have a better plan at that point. I thought, you know what? I'm going to go with them.
Empezamos a caminar con ellos, ratos caminando en autobús y en tren, un proceso de casi un mes hasta Tijuana.
So we spent about a month walking, buses, trains. We took the road to Tijuana.
Donde pasamos hambre, frío, sol, ladrones quisieron asaltarnos.
Hot, cold, hunger, the sun beating down, thieves robbing us. We had all that happen to us.
Pero aprendí de que la unión hace la fuerza.
But I realized that together people are strong.
Imagínense 300 personas caminando por las garitas y solamente diciendo adiós, inmigración no podía hacer nada para detenernos.
Just imagine, you know, facing this immigration situation, no one's going to help you. 300 people together, they have to say goodbye.
Eso nos hace fuertes.
This makes you strong.
Llegamos a Tijuana y allí tuvimos asesoría legal.
We finally got legal counsel in Tijuana.
Yo comenté mi caso y me dijeron que tenía posibilidades en este país, pero no tenía alguien que me recibiera o un apoyo que tuviera para poder decir si quiero ir.
They said that I could come to this country, but I didn't have any sponsor. I didn't have anyone to say, hey, come on, you can stay with us. I didn't have anyone to take me under their wing.
No sé qué pasó en ese momento en mi cabeza, pero yo decidí entregarme, entrar a la garita de Estados Unidos y pedir asilo.
And I don't really know why, but that was the moment when I finally made the decision to come into the United States and to seek asylum.
Estuve 7 meses detenida,
I was jailed, detained for 7 months.
que fueron muy difíciles
These were hard
por la
months.
forma en que uno es tratado, la forma en que nos ven de menos, por no hablar inglés.
You're treated in a way, people look down on you because you can't speak English.
Por venir de un país lleno de violencia y que acá muchas personas no nos creen.
You are looked down on because of the simple reality of the place you come from, because of the violence that is incumbent to the place that you come from.
Somos tratados peores que animalitos en esas detenciones.
They treat us worse than animals in these detention centers.
Aquí estamos hablando de salud y eso es importante.
Now, we're here to talk about health, and this is an important thing to talk about.
Allá adentro no tenemos buen servicio de salud.
We did not have health services in these detention centers.
Allá si uno se enferma, si a uno le duele algo, nada más le dicen, tomen agua, tomen agua.
You're sick there, they'll say, hey, drink some water.
Sabemos que el agua es bueno, pero hay enfermedades que necesitan medicamento.
Now, water is good and fine, but we all know some diseases, some sickness require medicine.
Allá adentro, si alguien le da un ataque en el corazón, se muere.
If you have a heart attack in there, you die.
Tardan 10, 15 minutos para atenderlo a uno.
You have 10 or 15 minutes for someone to come and intervene and help.
En ese lugar no tienen amor hacia nosotros, no tienen ni un poquito de consideración. Nos tratan como delincuentes, no sé. La comida es mala, la ropa es mala.
Love, respect, these kind of concepts are foreign to these places. They treat you like criminals, bad food, terrible clothing.
Realmente que esta mañana estoy un poco sin palabras.
I really, you know, to be honest this morning, I don't know quite what to say.
Sé lo que he vivido, lo que sufrimos los inmigrantes.
I know what immigrants go through. I know what we have survived.
Llegamos a estos países, pero aún estando aquí adentro hay muchas dificultades.
You get to the United States, but you still have hurdles to overcome.
Es cierto, necesitamos mejores servicios de salud,
We do need better health care,
no solamente para los inmigrantes, sino que para todos.
not just for immigrants. Everybody needs better health care.
Yo tengo problemas postraumáticos.
I have PTSD.
Algunas veces no duermo,
Sometimes I can't sleep.
de repente lloro por nada o al oír casos como lo que estamos oyendo acá, siempre tiendo a llorar, a sentir un dolor en mi corazón.
You know what? When I hear stories like we're hearing today, I cry. I feel this in my heart.
Esas son enfermedades por dentro
These are sicknesses you have, diseases you have on the inside.
que también necesitan atención.
These need care too.
Medical, me gustó lo que dijo el señor. Medical es un seguro que realmente casi nadie, no tiene nada de bueno. A mí me dijeron que lo único que podía hacer era en emergencias.
You know, I like what he said. You know, Medi-Cal, for example. Oh yeah, no, Medicare. It's no good. Oh fine, it's maybe good in the emergency room, you know, for an emergency situation.
Entonces creo que todos juntos podemos hacer mucho.
You know, I think together we can make this. We can do a lot to improve this.
Podemos empezar a cambiar las leyes, apoyar a personas que estén dispuestas a trabajar junto con nosotros
We can change the laws. We can work together with people that are willing to work with us.
para hacer cambios en este país.
We can change things in this country.
Este país realmente es de nosotros los latinos.
It's a country that belongs to us, really. Us, Latinos.
Los invito a todos a que trabajemos unidos
It invites us all to work hand in hand
en contra de la violencia a los inmigrantes
to
de este
work
país.
against violence that befalls immigrants that come into this country.
Que conozcamos un poco más de este tema para que podamos hacer mucho por este país.
If we work on this issue, we can create very good change for this country.
Hay cosas que para nosotros son pequeñas, pero para los inmigrantes son grandes, que nosotros podemos hacer.
There are things that might seem small to us, but if we do them, these are wonderful and big things to immigrants.
En las detenciones hay maltrato psicológico,
There's psychological abuse that people are subjected to in these detention centers.
hay mala atención, hay mala atención médica.
There's medical neglect.
Cuando las personas salen bien para este país o de regreso a sus países, llevan postraumas.
When people leave the centers, either to stay in this country or go back home, they're traumatized. They have PTSD.
Y nosotros podemos hacer mucho acá para cambiar eso.
We can do a lot here to change that.
Gracias a todos por estar esta mañana acá.
Thank you all for being here today, this morning.
Me siento muy feliz de estar en este lugar
You know, I'm really happy to be here.
porque yo soy inmigrante.
I'm an immigrant.
Todavía porto un brazalete de inmigración,
I still have my immigration bracelet,
pero yo también estoy en la lucha.
but I'm also part of
Y
the
los
struggle.
invito a todos que luchemos por un mejor país, por una mejor vida.
Let's all fight together for a better country, for a better life.
Que Dios los bendiga a todos.
God bless you all.
Thank you, Veronica. Next, we'll hear from Leah Spellman, who will shed light on mental health impacts of immigration to the United States and of life for immigrants who live here.
Hello, everyone. Can you hear me?
Yes.
Yeah. It's a pleasure to be with you all here today. I'm the Executive Director of Partnerships for Trauma Recovery. We're in Berkeley. And we provide mental health care and case management to refugees, asylum seekers, and other international survivors of human rights abuses. So all of our clients come from other countries. We've served clients from over 30 countries since 2016, and we've provided care in over 25 languages. The majority of our clients do come from Latin America, but as I mentioned, we serve clients from all over the world. And I thought the best way to really illustrate what it is that we do would just be to share an example of a client story with you. So this client comes from Mali in West Africa, and she has an experience that mirrors millions of other women in her country. When she was a child, she was frequently beaten by her uncle, and then when she was 12, she went through the process of female genital mutilation or female genital cutting. This is the case of 90% of women in Mali, and it's done under unsanitary conditions. And so she survived, her sister did not. She was put into a forced marriage. She was raped on her wedding night. She became pregnant. She had to have a C-section to give birth to her child. She couldn't because of her FGM. And when she got older, she entered into a relationship with a woman. She was found out about this by her community and beaten and raped because of it. And her father was taken and put into detention and tortured. So thankfully, her father was let go, but at that point, she knew that she had to flee if she wanted to stay alive. And so she was able to make her way to the United States, to the Bay Area, and found her way to us. So what we are doing for her is we are providing mental health care. She's seeing a therapist. We've connected her to one of our psychiatrists. She's receiving antidepressant medication and is doing better. And we're helping her in her asylum case. So she is an asylum seeker, and we are providing a psych eval, which is going to help strengthen her case in the asylum process. And we're also working with Highland Hospital Human Rights Clinic, which is conducting a medical forensic evaluation that is also going to be used to strengthen her case. So that's really where we operate. We live at the intersection of mental health, human rights, and justice, and very much see mental health care for individuals as something that can have this wider impact. We see the core of what we do, mental health care, as one piece of a much larger nexus of care. So that's one large component of what we do, and that's the core of what we do, mental health care and case management. But we also do advocacy and we do training. On an advocacy level, we're part of groups like the National Consortium for Torture Treatment Programs. On a local level, we're advocating on behalf of our clients and advocating, of course, to funders to make sure that they are directing funding streams towards our client population. And in terms of training, we're working with attorneys, with other professionals who are interacting with our client groups to help build their capacity to provide trauma-informed services. So, of course, as Judge Tabador mentioned, hearing these stories day in, day out can really have an effect on you, regardless of whether you're a mental health professional or working elsewhere. So we really want to work with other individuals to build their capacity to offer these trauma-informed services. So that's who we are, and that's what we're doing. And I wanted to share the story of an individual client today to just help show the picture of what it is that we do. I wish I could tell you that she's an outlier. I wish I could tell you that she's not representative of our client population, but she is. And we know that, also as Judge Tabador said, that human beings are capable of inflicting incredible cruelty, but it is an incredible privilege and honor as an organization to be in a place where we get to hold space and witness these individuals as they begin their path to healing and recovery. The fact that they have survived these things is a tremendous testament to their strength and resilience. It's phenomenal to think about what they've been through and the fact that they can go on with their lives. And we get to be a part of that process. So it feels an incredible privilege to get to do that. For all of you mental health care workers in the audience today, I just wanted to express solidarity and say thank you so much for the incredible work that you're doing. I'm sure that you all understand a lot of what we are looking to prioritize as an organization, which is the importance of not just advocating on behalf of our clients, but also attending to our own well-being. It is difficult to do this work and to do that sustainably. And so I just wanted to say that this is something that we are definitely continuing to prioritize as an organization, and that it's important that we take care of ourselves. So that's one thing. And the other thing I just wanted to emphasize, I would be really interested to get to connect with some of you later on and learn more about your experiences. But from our perspective, there's no reason, again, that a trauma-informed approach has to be relegated to a mental health care setting. The clients and the patients that come through your doors are going to bring their trauma histories with them, regardless of whether they're coming in on the mental health care side or whether they're accessing other services. So I would love to learn more from you all about your perspectives in bringing trauma-informed approaches outside of a mental health care setting and what that looks like. Thank you.
Thank you, Leah. We will now hear from Leila Razavi. She is going to give us an insight into what is happening on the national level related to the immigration issue.
Thank you. My name is Leila Razavi. I am the Policy Director with the California Immigrant Policy Center, and it's a pleasure to be here with all of you today, and I'm really humbled to be sharing the stage with people who are sharing such powerful stories today. I've been given the dubious honor of summarizing within 5 minutes all of what's happening at the national level. So I think the one thing I can say that would be most helpful in orienting all of you when you think about what this administration's policy agenda looks like for immigrants and refugees is to really look at one thing that Judge Tabador said today, which is that a colleague of hers asked if we could sue for intentional infliction of emotional distress. And what I would like to suggest to all of you is that this is all indeed intentional. It's very easy when you turn on the evening news to dismiss or laugh or roll your eyes at this administration as a circus or a reality TV show. But what's happening is truly insidious, and it goes a level deeper. We've seen administrations in the past that pursue inhumane policies that really hurt people. What we haven't seen is an administration that is hell-bent on actually obliterating our infrastructure, the actual system, civic society, the judicial process. These are things that will have lasting consequences. It's not going to be so simple as changing who's in the White House and then they'll put in a new policy. There's actual long-lasting damage that's being done here. So I could divide his work into 3 large buckets. There's 3 areas this administration is pursuing right now. The first is that they are prosecuting and criminalizing all undocumented immigrants in the country with zero discretion. This is new. In the past, under Presidents Bush and Obama, there had been discrete priorities where the administration would select categories of immigrants. And what this does is really touches again on mental health. What we're seeing is that within immigrant communities, there is a level of unprecedented fear, the likes of which we've never seen before. Some of the stories we're hearing from educators are particularly alarming. For example, in Oxnard School District, they have now had to institute a policy for deportation preparation in which they're sending school forms home with the children. The parents have to designate who the caretakers will be because it's become so frequent that parents are deported and no one is there to pick up the children. One school counselor in Escondido told me in the past, 1 or 2 children per year would have a parent or family member who's deported, and she says now it's a weekly occurrence at least that a child is in her office crying. So we're really living in a world in which these children are growing up seeing their parents plucked out of the community in a way that is it's so random and unpredictable that it's creating a level of distress. And indeed, the previous ICE director, Tom Homan, stated, and I quote, he said, "You should look over your shoulder and you need to be worried." So this is an administration that the agenda is to cause fear and wreak havoc on the well-being of these communities. The second area the administration is aggressively pursuing its agenda is the prosecution and deportation of all new entrants that are arriving at the southern border. We've heard a little bit about what that looks like today. Judge Tabador discussed some of the things they're doing in the court system. It certainly goes much further than that, and the area that's particularly alarming is with respect to child detention. So right now there is a legal precedent that limits how long the government can hold children and families in an immigration detention prison. They are now seeking to completely remove that rule. They have put up on their website a proposed new rule, and they are seeking comments. So in the first week of November, they will make a determination whether or not those rules will go forward. But if this rule change takes place, what we will see is potentially a limitless detention of children in immigration prisons. And indeed, they've already taken steps to expand, construct, and detain more children in immigration prisons. The third area of work I think is especially alarming. They are entirely dismantling the immigration system. So that means the refugee resettlement structures are all being dismantled. Most of our resettlement agencies are operating in the red and are closing their doors. The asylum process is similarly being completely obliterated. There have been legal decisions taken by the Department of Justice that are making it more difficult for people to come and seek asylum in the country. And then the third one that I'd really like to highlight for all of you as healthcare workers today is around family-based immigration. So we heard a really compelling story from Judge Tabador about how her family was able to enter based on a sponsor letter from her uncle and based on her grandfather's need to seek medical care. On Friday night, 2 nights ago, the administration threw up on their website a new proposed rule change. What this rule would do would make it very difficult for people to seek a green card if the government believes that they are ever likely to use a long list of public benefits. Those include Medicare and Medicaid. This is something we've heard about for a long time. You might have seen it in the newspapers referred to as public charge. The question being considered is whether or not the individual who's trying to immigrate is a public charge of the state. But this rule has really devastating consequences, and more than any population, it's targeting family-based immigration, which we know this White House has been very vocal about opposing. So this is just one thread of how they're moving in that direction. Similarly, that was Friday night. There is a 60-day rule period. So there is a robust campaign that has already taken shape. You can go to the website protectingourfamilies.org and go to the link on Take Action. I truly believe as healthcare workers, you all are in a unique position to give voice to what you're seeing in terms of the patients and the communities you serve. I believe that the infrastructure that we're looking at right now that's being dismantled, it's going to take a long time to rebuild. But I think voices like all of you who are in the room are truly critical in terms of being able to articulate what it is that we're seeing, who these people are, what their healthcare needs are, what their mental health needs are, and making sure that we can stand up together to oppose this change. So I will stop there because I'm being told we're running out of time, but I'll be happy to answer questions at the end. Thank you.
Thank you, Layla. And now we will hear from Angela Chan, who will be sharing with us her work in advancing legislation to support immigrant rights.
Hi, everybody. Thank you for having me here. It's really incredible to be in this space with all of you who do such important work for our communities. I'm at the Asian Law Caucus. We're located in San Francisco. We're the oldest nonprofit serving low-income Asian immigrants, and we do serve immigrants of all backgrounds at our organization, and one of the few organizations that provide free legal services for people who are currently detained who are facing deportation. We have 7 programs, including criminal justice, immigrant rights. We also work in the area of national security and civil rights issues, and we also have an undocumented Asian youth program. So I think Layla did a great job of laying out all the issues we're facing at the federal level, the attacks that are occurring against immigrants launched by the Trump administration. And I think what's really troubling is that the people who are writing some of these proposed policies and some of these actual implemented policies that Layla laid out are white nationalists. These are white nationalist anti-immigrant organizations who now work for the Department of Justice and the White House. Who are, their dreams are coming true of using immigration law as a way to engage in ethnic cleansing of the United States so that we reduce our minority population, because it's really not about all immigrants, it's about immigrants of color. And that's really what the wholesale vision is of the White House's and the Department of Justice's immigration policy right now. Every one of these different policies coming down are meant as a way to exclude non-white immigrants from this country. And that's depressing, and it's very scary and stressful, but I think there is hope, there is light, and where that is coming from is from the local and state level. At the local and state level, people are organizing, people such as yourselves, and are fighting back, and are moving local policies and state policies to protect immigrants. California has been a leader of this. And you heard from Senator De Leon, he's been also a really important champion of this in California. And so what we're doing is we're moving sanctuary policies. We're saying that local and state law enforcement agencies and public agencies do not have to help ICE. ICE has a lot of immigration agents, but they only have so many. If they were to work alone, it'd be much harder to engage in mass deportation. But if they are able to co-opt all police officers, all sheriffs, all probation officers, all public agencies, and they're going to be able to really terrorize immigrants in every avenue of their life and detain and deport many more people. And California has the largest immigrant population in the country and the largest undocumented immigrant population. So we have a lot of people to protect. And so that's why it's been important to move these laws at the local and state level. And so to give you an example of some of the laws that we've moved, one is the Trust Act in 2013, and I have to point out that someone in your audience here, one of your organizers, Renee Saucedo, helped really spark that effort. And it started at the local level in San Francisco because we were defending our sanctuary ordinance, which was under attack, even though it's the oldest sanctuary ordinance in the country. In 2008, it came under attack because of a horrible tragedy that occurred involving an alleged undocumented immigrant that then was exploited. Sound familiar? The Trump administration, fast forward, did a very similar thing years later. But we had to defend our sanctuary ordinance, and through that effort, through local coalition building, realized that this is a much bigger issue than San Francisco. We need that sanctuary is needed throughout California, and that there are rapid changes occurring within ICE that are automating it and making it very, very easy for police to work with ICE and to basically turn over every single person that's suspected of being removable, both documented and undocumented. If you have a green card and you're arrested and charged with certain offenses, sometimes you can be put into immigration proceedings. And so that led us to move the Trust Act in California that would limit when local law enforcement can hold someone for extra time for immigration. So we put a limit on ICE holds. And that was something that was the first state piece of legislation in the country and has really inspired hundreds of other jurisdictions throughout the country to copy us. And then fast forward to 2017, with the election of Donald Trump, we knew in California that we really needed to move stronger statewide sanctuary policy. And the funny thing is that we've had this policy in our pockets for a while. There just wasn't political interest in doing it under the Obama administration. But when you have such a stark anti-immigrant political officials, in D.C., then you're able to really make the case in California for moving this policy. So in 2017, we moved and passed the California Values Act, authored and led by Kevin De Leon. And it's an omnibus bill. It's the strongest sanctuary policy in the country, and to give you a sense of what it covers, it places limits on local and state law enforcement in assisting ICE. For example, they can't ask individuals about their immigration status. They can't arrest people for immigration purposes. They also can't notify ICE about when someone's going to be released from a jail, with some exceptions. They also can't allow ICE to have an exclusive office in jails. Believe it or not, a lot of jails have actually a designated desk or office for ICE. And we also ended the notorious 287G program in California, which is a program where ICE contracts with local law enforcement to train and deputize local law enforcement agencies to act as immigration agents. And so that has been a really big piece of SB 54. Another piece I wanted to cover that really impacts a lot of your work is that we were able to get in a provision that would require the California Attorney General's office to issue model policies to public agencies that would limit their assistance with ICE to the fullest extent under federal and state law. There's a lot that can be done under federal and state law to actually not work with ICE. There's a lot of things you don't have to do. And the public agencies covered include public health facilities and courthouses and public schools and a whole long list of other public agencies. These policies are going to be issued by October 1st, so coming up in just about a week, you'll see these policies. And so please be on the lookout for them. We'll be posting them on iceoutofca.org, iceoutofca.org, which is a website that we maintain to educate the public about sanctuary policies in California. And lastly, I know my time's wrapping up. Lastly, I wanted to point out, and I don't know if folks are here are familiar with AB 450, just a raise of hands if you are. I see a few hands. So AB 450 is a companion piece of state legislation that is law now in California. It's the Immigrant Workers Protection Act, and it imposes requirements on workplaces to adopt sanctuary policies. And the Trump administration has challenged this law in a lawsuit, and they've been able to suspend certain provisions in this sanctuary policy. And what I wanted to really highlight for you today is that even though some of these policies are temporarily suspended under AB 450 for workplaces, it's something that you can get in your union contracts. And if you get them in your union contracts or get your employers to voluntarily adopt them, then they have to follow them. What the Trump administration has done is just suspend the requirement that they have to do it under state law, but employers, again, can choose to voluntarily do it, and you can basically make them do it through organizing. To kind of end, I'll list out some of the key things that you could get them to do and check to see if they're already doing it. Your employer could require that ICE produce a judicial warrant, a warrant signed by a judge, before allowing them access to a workplace. In most cases, when ICE engages in an ICE raid or a visit to any facility, they do not have a warrant signed by a judge. They have fake warrants, a warrant signed merely by ICE agents that really have no legal weight, and you can say no to them. To add this restriction would be very important in preventing ICE from accessing a lot of different spaces within healthcare facilities. Also, you could have your employer request a judicial warrant before releasing any employee records. That's also something that certainly can be done. You can also ask your employer to not re-verify the status of current employees. They do verify upon hiring individuals, but they don't have to keep re-verifying. And so that's really important. And then another piece is that they could, and this is actually a binding requirement now under AB 450, despite the lawsuit, they are required to notify workers if they receive a notice of an I-9 inspection, which is basically like a silent workplace raid, where ICE is asking for documents to show that employees have a work authorization to be in this country. So, think through these if you haven't already thought through them, and check out our iceoutofcalifornia.org website for more information. But I think there is a lot that can be done at the local and state level and in workplaces. And I know that you passed a sanctuary resolution that supported these sanctuary policies, and we really thank you for that.
Thank you, Angela. Before we start the Q&A period, I just want to say that all of the information that you provided today, the websites that we can go to, links to your organizations, if you can provide them to us, we will put them on our website so that people have access to it and get the information quickly. Thank you. So now we'll begin the question and answer portion of our panel discussion. We have some time left to take some questions from the audience. We have staff positioned around the room with microphones, so if you have a question for one of our panelists, please raise your hand high and we will come to you. Okay, in the corner there, please.
Hi, my name is Melissa Hawthorne Campos. I'm a psychotherapist with Hyatt, and I used to be a victims advocate, and this was many years ago before the current administration. And I know how many victims were afraid to come forward and report being victims of crime. What's currently being done to make sure that victims of crime can still come forward and report their crimes?
Yeah, I think that is a large reason behind moving these state sanctuary policies, is to prevent local law enforcement from working with ICE, and they do work with ICE in so many ways, even in cities that are thought to be progressive. There are many different ways that local law enforcement will turn people over to ICE, alert ICE about an individual, allow ICE access to their facilities, and that really scares victims of crime from coming forward, especially there's one particular category of people that are most vulnerable to this, people who are domestic violence victims. Police often, when they get called to the scene, they're not properly trained to handle these situations, and because of bias with police officers, they might arrest the domestic violence survivor, the victim, rather than the aggressor, and then that individual ends up in police custody, and then because of these awful policies where they work with ICE, can end up in ICE custody and actually deported. And we've actually dealt with a number of these cases in California, and the victims that have been able to fight these deportations have actually been the leaders in moving state sanctuary policies by coming forward to share their story. So that's one important way, and that's part of why we, Layla and myself actually both together work in a coalition called ICE Out of California that has moved these policies for this reason.
And if I can just add, there's also a bill currently on the governor's desk that would allow people who are coming forward in court to use a pseudonym. So I'm happy to include that bill number and information.
Please. Great. Corner.
Hi, thank you so much for being here and for all the great work that you're doing. I had a question about the different kinds of status that people might have, because I think sometimes our members, in conversations that I have with some members, they might think that, oh, well, we don't have undocumented workers in our union. That doesn't apply to us. That doesn't apply to my coworkers. But I think it would be really great if you could talk about also, the threats to people who have temporary protective status. We have a lot of, I work with some of our nursing home workers, and we have workers from Haiti, from Nicaragua, from El Salvador who have TPS, people from other countries. So if you could talk about also, the threats to people with those kind of status, and why not re-verifying people because they might lose their status. So that would be great. Thank you.
Yeah, so the administration has been methodically letting people who have TPS status, that's temporary protected status, they've been allowing their status to expire. So we have people from a lot of different countries who have been granted through Congress, through legislative acts, status that allows them to stay in the country and work even though they don't have another valid, say, green card. And as those have been expiring, in the past they were automatically being renewed by previous administrations, but they've all been allowed to expire. So what happens is people have a work authorization card and it's not getting renewed, which is why I think Angela's point becomes critical. The one exception to this is with people who have DACA status, they're currently able to apply to renew their DACA status, and those are valid for 2 years. So if an individual can make sure to get in and apply to renew, they'll have that for 2 more years. There isn't really a good solution here. I think this is why things that are protective, and we're primarily operating in a defensive posture in this area, unfortunately, but that's why things like the model policies that are coming out on Monday, October 1st are so critical. And that's why things like protecting AB 450 are so crucial, because that's also being litigated in court right now. The government is suing. But those are the places where we have some ability to put in protective measures in place to ensure that these workers who are really ripe for retaliation are protected, because the federal government is not doing it.
Thank you. Over here in the red sweatshirt.
Hi, thank you again for all your excellent work. Y señorita Aguilar, gracias para su historia, es muy importante. Gracias para ustedes aquí. Gracias. We are kind of all in crisis mode, the whole nation is. And my hope, and I dream every day that we will wake up and this will be over. So in the event that this dream come true, I want to know, what are we doing moving ahead to draft sensible legislation that this should never happen again, that we have a sensible pathway for our brothers and sisters to become citizens and share the bounty of this great country?
Well, so immigration reform, I think, is something that we all dream of. But I think the challenge is fair and comprehensive immigration reform. Even when there was the biggest possibility of immigration reform under the Obama administration, it was still really difficult to actually come to an agreement, because I think the issue is that when that conversation happens, often there are a lot of people who get thrown on the bus, including people who do have criminal convictions, who might have turned their lives around and really should be here with their communities. And so I think when we talk about immigration reform, we always have to be kind of thinking about the ground movement behind it and making sure that we are united in moving immigration reform that doesn't have pieces in there that we'll regret decades later. And I think that's part of the issue. I mean, one of the policies that I think is being exploited tremendously by the Trump administration passed in 1996 under the Clinton administration. It's called IRA. And that immigration law actually took away a lot of discretion from judges for people who do have criminal convictions, people who had green cards and then lost them because of being criminalized, and also sometimes will face mandatory detention and deportation. And so a lot of that is what the Trump administration is exploiting now and putting on steroids. And so I think we definitely want comprehensive immigration reform, and we have, I think, most of our organizations have written out here the principles of what we want and have that kind of in our back pocket. And I think the issue is making sure that we are ready and organized in a way that we're not easily divided when that opportunity does come up in the future.
Yeah, if I can just piggyback off that. I think as the situation in Congress is becoming more dire, people are demanding more action. The opportunity does open up, as Angela mentioned, at the state level to explore more robust policy solutions that maybe in another political context were not palatable. So we've recently launched an economic justice platform in our organization. It's on our website, and I'm happy to share that in the resources afterward as well. But we're looking at things like economic inclusion, really supporting access to jobs and training. We recently passed a law that the governor thankfully signed, which allows people to apply for a small business license with their local government, regardless of whether they have a social security number. He also signed the Street Vendor Act. So we're really looking at ways that we can deal with this workforce that we have that's clearly being abused and taken advantage of in the current economy. California has the largest income gap of any state in the country. We have a massive amount of wealth and poverty and rising cost of living. So I think we're starting to think about how we lay out a path for a better future, irrespective of Trump, because there's a lot of work that we need to do, and we're laying that groundwork, as you rightfully mentioned, about how to build out a better future for workers and for Californians, regardless of the person who's occupying the White House.
Other questions? So Layla, Leah, Angela, Veronica, and Nicholas, thank you so much for being with us today. We so appreciate it.